Diabetes is now the number one cause of death in the country. Therefore, it's important that we started responding to it to a scale that match the crisis, as we want to call it. We are demanding urgent action. Diabetes have now reached a turning point in the country, a moment where we need a major response.
Hi, Patrick. Welcome to the Via Diabetes interview series. It's great to have you.
Hi, Olivia. Thank you for having me.
Can you give me some idea of your biggest highlights with respect to your personal impact on the diabetes community?
I'm originally from Cameroon. I'm living in South Africa for the past almost 20 years now. I'm trained as a medical doctor, moved to South Africa to study public health, which I did up to a PhD. And while I was doing my PhD, which was a topic on diabetes, we were supporting primary care facilities as they transition patients with type 2 diabetes from oral drugs to insulin. So while I was doing that work, I got introduced to advocacy and to the Diabetes Alliance. In 2021, we started what we call the Diabetes Summit, which is a platform that brings together all the role players in South Africa, from government to private sector to people with diabetes. Is basically whole of society response. I'm quite proud of the latest Diabetes Summit that we had in 2025. We had a 3-day event with almost 400 people in attendance, including the Deputy Minister who was there for the opening remarks.
What is the state of mental health support for people living with diabetes in South Africa?
For the longest part, even if we refer to the diabetes guidelines that are available in South Africa, the clinical guidelines, whether it's from the public sector or from the Society of Endocrinology, Metabolism and Diabetes in South Africa, there's little space for mental health in diabetes. We left mental health aside. We completely forgot about that aspect because we didn't know. Even when I look back at my training as a medical doctor, there were really little mention about mental health and diabetes. I think from the doctors and the nurses' perspective, there's really a lack of knowledge there. That's why with the 2025 Diabetes Summit that we had last year, we had a specific workshop looking into diabetes and mental health, trying to start the conversation and trigger those conversations among healthcare providers.
You were a general practitioner. I wanted to ask what your opinion is on stigma that people living with diabetes face with doctors.
Stigma in the health settings, the healthcare settings, is a reality. We understand that a lot of the stigma that people with diabetes are experiencing in the healthcare settings are for the most part linked to ignorance from the healthcare providers. I think we need to be honest and we need to admit when we are failing somehow, starting from the way we are taught about diabetes. It's described as a lifestyle condition, which obviously put a lot of burden on the individual, meaning if you have diabetes, it's because of the choices that you make. A lot of healthcare providers who are still using insulin as a punishment or presenting insulin as a punishment in a way to say, oh, look at your glucose numbers. If you are not doing better, I will put you on insulin. It actually leads to patients being so worried and so scared about insulin that they tend not to accept when the time comes for them to be on insulin.
Sometimes health practitioners don't always love it when you criticize them for how they handle things. As someone who has been a practitioner, what kind of approach could we take that wouldn't look so much as an attack?
That is a very challenging question because obviously, as you know, it's there's power imbalances in the relationship patient to doctors, even more so in our public health system in South Africa, whereby our people with diabetes are very much disempowered in terms of understanding their condition, understanding their rights, and understanding what to expect when they are accessing care or have interactions with the health system. At the end of the day, I think it's establishing trust in any relationship can always be a best starting point. A lot have eager to learn is just about setting up the environment so that those kind of conversations can happen and they are also safe. They don't feel threatened by the conversations happening.
You helped launch the Johannesburg Declaration for Accelerated Action on Diabetes in South Africa. Why is this significant, and what kind of impact do you hope it will have on people living with diabetes in South Africa?
Fortunately, based on Statistics South Africa publication, diabetes is now the number one cause of death in the country. Therefore, it's important that we started responding to it to a scale that match the crisis, as we want to call it. We are demanding urgent action, and we are wanting to get the attention from the highest office in the land, from the president of the country, to understand that diabetes are now reached a turning point in the country, a moment where we need a major response. We want him to declare diabetes a public health crisis. We believe that's how the president can lead a multi-sectoral approach, whereby it's not only the Department of Health, but it's also economy, it's also agriculture, it's also trade and industry, all those departments, social development, women and children, education, all those departments have to come together and agree in a common response, a coordinated response. We have a national strategic plan for the prevention and control of NCDs that was put out already in 2022, but there is no financing behind the program. So calling on the Treasury to really ring-fence funding and put aside specific funds to respond to diabetes. In the declaration, you have a paragraph about stigma and the fact that we need to see more person-first languages. We need to see a health system that is rather supportive and not stigmatizing, and all those elements.
Is it side conditions, or is it actually like diabetes is killing people?
That, again, is a very critical question, because for the past many years since the first diabetes summit, what the Diabetes Alliance has been calling for is for a strong diabetes surveillance system, meaning monitoring mechanisms, data system that will allow us to answer questions such as the one that you are raising. In the document from Statistics RSA, it just said diabetes. They don't have the capacity to break it down because they are collecting that data from the death notification that is compulsory in South Africa, whereby a doctor has to sign a death notification once a patient unfortunately passed on. Somebody might have lose their lives because of a complication of diabetes, and then they will maybe write on the document kidney failure. Meanwhile, the underlying cause was diabetes, but it was just seen as kidney failures. A completely overhaul of the way we manage diabetes is a priority, and obviously management system, monitoring system, data systems, as I mentioned, because we need to be able to measure our efforts. We need to be able to see where are we making progress or where gaps are still persisting.
You are driven by one question: how can we design equitable NCD systems that center people and not just protocols? What kind of responses or conclusions you've already been able to come to so far?
It's a work in progress, but I think so far one of the number one critical thing that we are not necessarily doing well is the meaningful participation of people with lived experience in all those processes. Because if we want to design a person-centered NCD resilient system, it's important that we put people at the center and we recognize people with lived experience as experts in their own right. So that shouldn't just be a lip service. We should be intentional in how we introduce or we include people with lived experience in the conversations. For example, where there are barriers in terms of transport or whatever costs that could be associated with them participating, we need to address that. We need to ensure that their voices are understood. One of the critical points that I've been trying to put across is that Africa is described as a very young continent with an average age of 18 to 19 of the age of the population. But already we can see the mortality is dominated by NCD. So one can only imagine how worse the situation can get if we don't do the right thing today, when the population starts aging, it might get obviously worse. So therefore, my call is for today, for us to implement measures that will help us to prevent a worsening situation tomorrow. That applies for diabetes, that applies also for NCDs in general. That means obviously for us being part of the conversations at the highest level and being able to influence the policies that are taken in the country and the direction that governments are willing to take for the sake of the population in order for us to have a healthy, strong population in the future.
Well, thank you so much for joining us, and it's been an absolute pleasure to get to meet and talk to you. I think what you're doing is extremely important, and I hope that all of our viewers will will appreciate everything that you're doing as well. It's been wonderful to have you on the series.
Thank you, Olivia. I appreciate it. It was great talking to you.